is Dr. Abbasi. This is a patient we are taking for the OLLIF revision in the L5S1. We have non-union. And one of the problems was that the disc space was very large, actually would accept a 14 millimeter cage, but especially the approach is very limited for 5S1, so a 12 millimeter cage was inserted. And now we are not only doing the OLLIF from the other side, from the contralateral side, practically I'm leaning over and approaching that from the other side. And please take a look at the films now. And it's ready for the cage to be inserted. You see the ring correct, and you see the cage on the other side. But on top of that, this is a very large cage. It's a 14 millimeter cage. What I'm going to do, I'm going to insert the cage actually not in the usual pattern, whereas the nerve root is here, end plates are here, but I go parallel to the end plate, but I turn it then in situ to the full position. This cannot be done with the PEEK cage, but the titanium arrow cage really allows that. That's good for that. So you can now actually get a picture where I'm inserting it, but then look at the x-rays on both of them. I'll get some flow when I'm turning the x-ray. So the cage is going to, the camera is in place, the tube is coming out. Yeah, it's very narrow there. Cage is going in. You have to pay attention, especially on the contralateral side, that we do not put any lateral pressure on the K-wire. We don't accept any stress at all. And again, here you're going parallel to the end plate, X-ray, and a very small pad. Make sure that you're absolutely perpendicular to the K-wire, X-ray. Signals are all right?
Signals are all right.
Good. X-ray. So we are slowly approaching. You see, I have to adjust with a little bend. X-ray. X-ray. Now I'm going to remove that just a touch. X-ray. And approach it more. X-ray. I use this part of the hammer not to slip. X-ray. And remove little by little the K-wire. X-ray. Double bend. Normal. Small stick. X-ray. Now, look at the X-ray now, please. Are you getting X-rays now, Lindsay?
Yep.
Good. So here we go. X-ray, almost there. Now, let's do a big mallet now. X-ray, I'm entering it. So we can take a little out. Now, big mallet back. X-ray. This is a very large cage. Signals all right?
Signals are all right.
Because we are not using the 14 millimeter length of it, but we are using the flat end of it. X-ray, the K-wire is removed. Now we are entering. X-ray. Now we are completely on the disk space. And now on the AP, get the fluoro. And you just pay attention to that picture, please now. Get AP fluoro. Is it fluoro? AP fluoro. And now I'm turning. X-ray. X-ray. Now I'm in the final position. Practically now the holes, the actual 14 millimeter is from end plate of the 5 to S1. Thank you. You can stop fluoro and you can stop